Hello, I'm Dr. John Michaelos, and I'm a corneal specialist at St. Michael's Eye and Laser in Largo, Florida. A question asked frequently is if vision can affect memory, balance, and mood. And the answer is yes, it can, all three. Vision is an integral part to our abilities to navigate the world on a daily basis. And it's the visual clues that we get that keep us balanced, that keep us involved in our daily interactions with people. And also it helps us to form visual clues to remember where to turn to go to your favorite restaurant. So all of them are linked and are wonderfully, perfectly put together by the Lord to help us to be able to navigate our day on a daily basis. When vision is not as good as it should be, it can be impactful to memory, the abilities to stay balanced, and also our mood. When patients have cataracts and their vision is not as good as it needs to be, frequently those patients come to us because they've fallen, hurt their head, and they need to make certain that their eye wasn't harmed from the fall. Talking to those patients, we find out that they inadvertently tripped over something that they just didn't see. And they didn't see it because the cataract was in the way of their good vision. So balance can be obviously interfered by having poor vision. And to prove that to yourself, close your eyes and try to walk across your room. Make sure the room's cleared, make sure that you've got someone around to catch you if you fall, but balance can be affected by your vision. And in those settings, getting the cataracts fixed is the right, prudent thing to do to help improve the balance and help improve your vision. Mood. When patients don't see well, many times they'll become more isolated from society. They don't care to go out. They may not see as well, don't feel comfortable driving, and sometimes shouldn't be driving because they don't meet the legal requirements to be able to do that. And if they're not going out and engaging, a lot of times that'll get people more down into the dumps. When vision is poor, helping the vision to be made better usually allows those people to interact better, get out, and enjoy life more. In patients that have visual issues that aren't amenable to correction, like my mom, she has very advanced macular degeneration, and so she has to stay home quite often. It's a treat to take her out, but when we take her out, we have to be very cautious so that she doesn't trip and fall over something. And she has always great spirits. She's a tough lady, but I can tell that it does affect her personally. And in those patients that have vision that can be made better, you'll see their affect and mood improve tremendously with their vision improvement. And we see them back a week or two after their surgeries, and those patients frequently are just extraordinarily thankful for the vision being restored. Vision can even affect memory. There's been studies performed where they took groups of patients that had cataract surgery versus groups of patients that did not have cataract surgery, same age group match. And the findings were pretty astounding. 30% of the patients that had cataract surgery had lesser degrees of dementia of all forms and Alzheimer's. So we have conclusive evidence that vision can affect memory. When balance, mood, and memory are not good, that can affect your overall abilities to have a good, productive life. So if you or someone you love or know has a mood, balance, or memory issue, the good news is there may be a solution to your problem. Having your eyes examined by an eye care specialist would help us to understand if your vision is keeping you from enjoying the full extent of your life.